Okay, let's read this. This is a question paper. This is a case note. It's a good one. Most of the questions that come in the exam are like this. Referral letters are extremely common. Um, Usually, the type of the letter is going to be given at the bottom here. You see the writing task. You see, using the information in the case notes, write a referral letter. So this is a safe letter. That means you do not need to worry about the type of letter that you're writing. There are other types of letters as well, discharge and transfer, right? I've noticed that sometimes they don't put the type of letter in the writing task, and you need to guess it by yourself. So this one definitely is not a headache, right? So let's read this and try to understand. I'm going to teach you how to write everything, and then you're also going to do this as a homework, right? So it's you are a registered nurse in a hospital where Mrs. Charlotte Price has been staying. She is now ready to be discharged with home visits from a community nurse. So you must be thinking uh, that since the patient is getting discharged, why is it not a discharge letter? Why is it a referral letter? These kind of questions come into mind. I will answer that in a while. Let's read this first. So, name of the patient that we have here, Charlotte Price. Yeah. Then date of birth is there August 4th, 1932. DOB is given. That means there's a section where you have to write the date of birth of the patient. Then we have age. Age and date of birth both are given in this question in this case note. So I'll tell you the location of both in a while. Now admission date 2nd December 2018. Discharge date 4th December 2018. That is 2 days of hospitalization, isn't it? Very easy. 4 minus 2 is going to be 2. Then we have diagnosis, mild concussion, following fall at home, infected right toe, discovered during hospital stay. Okay, during hospital stay, we found out that the patient also has infected right toe, but the reason why the patient initially presented to us was mild concussion. Concussion means tago toki dakeri, the things that you have, the injury and the dizziness that you feel, right? So falling a fall at home. So what we need to summarize here is the patient came to us because of concussion. Taugo tokera, lore bachi. And in the meanwhile, while the patient was hospitalized with us for 2 days during the care, we also noticed that, right foot, right toe is infected of the patient, right? Then check this out. Then we have a social background of the patient. You must be noticing we have sections, different sections written in bold, their patient and date of birth, age, admission date, discharge date, diagnosis, social background, medical history. I'll tell you how to manipulate all this, but for now, just let's read it and try to understand more. Look at the first one here. Lives alone, reluctant to receive visitors. Yeah, not very social person. Yeah, our Mrs. Charlotte Price. Then we have a retired 17 years ago postal worker. Two children, both medical doctors. One lives overseas. Husband deceased, lung cancer 14 years ago. Owns dog. Neighbor walks it occasionally. She's 86 years old, pretty old, right? Lives in three-bedroom house owned by daughter. Wants to live independently. Refuses meal delivery service. I mean, somebody who is old and by herself. Obviously, there are systems of food delivery for elderly in foreign countries. Then we have reluctant to visit GP. So that means she's also denying medical intervention. She doesn't want to be intervened medically, right? Doesn't want to talk to the GP. GP, general practitioner, right? At risk of falls, walking stick, scoliosis, infected toe. Why is she at a risk of falling? Because of walking stick. Then she also has scoliosis and then infected toe as well, right? Medical history: severely infected right toe, approximately since approximately 9 by 18. That means September 18th. Result of untreated ingrown toenail. That we have conjunctivitis, three occasions, that three times when the patient had conjunctivitis. We do not need to give the details when it happened. But if you are writing to a ophthalmologist or eye doctor, then of course you need to tell, okay, this one happened. But just knowing that it happened on three occasions already enough for us. She also had gastroenteritis once, both possibly associated with poor hygiene. That means she doesn't live clean. It's quite understandable. In our countries, we have relatives, sons, and everybody else taking care of the elderly. But in foreign countries, it doesn't work like that, right? They usually live in a retirement home, or there will be some professional taking care of them, right? So obviously, she's 86 years old, and it's difficult for her. So obviously her hygiene is not that good, isn't it? Then we have skin cancerous mole times three. I mean, I really don't understand what does that mean. I mean, maybe three times cancerous mole removed in 2000. So what is the year we're living in according to the question paper? According to the question paper, this letter is framed in 2018, and so mole removed in 2000. That's 18 years ago, right? Knee replacement 1998, whiplash injury 1987. That's a head injury, type of head injury. Now, we are going to talk about the relevance of all the information, the things that needs to be included in our letter. In a medical background, we have hypertension, 25 years, occasional drinker, whiskey. That's a spelling mistake there, whiskey. Whole heavy smoker, 40 per day. She smokes 40 cigarettes per day, urinary incontinence, mild scoliosis, walks with stick, and then medication that she's under, Ramipril 10 mg, hypertension, ibuprofen, as required. That means SOS basis. That means on need basis, right? They also call it PRN on OET question paper. That PRN is equal to our SOS. We have amoxicillin 500 mg 3 times a day, 2 weeks for toe infection. What it says here is concern in the bracket. You'll see the little parentheses there. Concerns RE compliance. Meaning is concerns regarding compliance. What is the meaning of that? That means the patient doesn't take medication. That means the patient has issues with compliance, right? Now, then we have nursing management progress. So, whilst she was hospitalized for 2 days, so was, there were certain interventions that we did from our part as a nurse. That's going to be this nursing management and progress. So, what we did here concussion tests, initial questioning, satisfactory. Finger, nose, finger test, satisfactory. CT scan, satisfactory. 48 hours, precautionary admission, monitoring and rest. Now ready to be discharged home. Right to clean and dress, antibiotics are prescribed. We've already written there, right? At the top, you see amoxicillin, that's the antibiotics. So, nursing management and progress, that's the paragraph, that's the heading that's given there. And then we have a discharge plan. Home visits by community nurse twice a week. Provide assistance with showering and dressing. Provide advice regarding head and food hygiene. Oversee treatment of right toe. Clean, change dressing twice a week. Encourage adequate rest. Monitor medication compliance. Amoxicillin and Ramit. So these are the things that the reader of our letter should do. So this patient is under our care for 2 days. If you are writing the letter, that means you should imagine that is your patient. And then, sorry, this is your patient. In the writing task, you see, using the information in the case notes, write a referral letter to Miss Leila Ward, community nurse, Ashton Healthcare, blah, 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 blah. Right? Outlining the patient's current condition and needs for or ongoing care. Now, let me tell you something. The first point that I brought into light was, why is this a referral letter when the patient is being discharged? Yeah. Why is it a referral letter if the patient is being discharged? So you should know the basis. Referral letter is when we are not able to fix the patient. I mean, why do we refer a patient? We refer a patient when the patient doesn't get better in our care, right? And why do we discharge a patient? We discharge the patient when we know that the patient is getting better, or at least in the path of recovery or fully recovered. These are the basis of referral discharge. You must be noticing here in this patient's condition. I mean, her condition is still not fully satisfactory. Of course, mentally, I mean, the fall injury and all those things are fine, but there are so many other things that the reader of the letter has to still do it for us. That's the reason why it's a referral letter, right? So we've read all these. We see there are different sections here: discharge plan, nursing management and progress, medication. We have medical background, medical history, social background, diagnosis. We have different headings here. Now we need to manipulate these headings and form a letter. And there are also a few traps that are set by OET people, those who form these case note who make these case notes. So you must be seeing here in the social background, it's written here. See this? In the social background, at the risk of falls. I mean, this could have been given in medical history as well, isn't it? I mean, since we are already talking about medical history in the subsequent section, why talk about at risk of falls in social background? Why? So most of the candidates who appear for OET examination, they have a habit of writing in this direction, like this. Okay, social background. I'm going to make this into a sentence, and then I'm going to make it into another sentence. I'm going to make it into another sentence, and another, and another, and another, and another, and another, and another, and then I'll write a history, and then another, and another. This is called expanding a note. Expanding a note means you do not use additional or your brain. You don't use your brain to understand, cohese the letter, and blurt it out in your own words. You don't do that. I mean, understanding and expressing in your own words and in your own style is what is expected to be done. But on contrary, most of the candidates, they rely on background and then they just move like this. So see, so this is the trap that's set at risk of falls. It could be easily included into the medical history, but still, you put it in the social background because it is given like that on the question paper. So this is the most common blunder made by OET candidates. They think that okay, I should write in sections. Yeah. So again, the medical history. How would you write? How would you write the medical history? Again, you'll go like this. You keep moving like that, and again you keep moving like that. So that's the mistake you do. But in the initial stage, when you once you are learning how to write, of course it's important for you to start walking first before running. The transformation that I just mentioned to you guys, the transformation means understanding the note and presenting in your own style. That means running. So in the initial phase, at least you should learn how to walk. So expanding also is satisfactory for me. And once you become very confident with expanding, you will start learning and you'll start understanding different aspects and facets of writing, right? So for now, just expanding. Later, after having a bit of experience, I'll teach you transformation. Transformation. Yeah, after let's say around 7 letters or 8 letters or 10 letters, I expect transformation from you. Now we have different headings, like I said here: medication, nursing management, and progress. So first of all, the question is, what do you do when it comes to writing? How do you start the writing? How do you begin the writing? Since I think you must have all watched the videos that I've sent you in the beginning, it's a prerequisite for the admission. Anybody who gets admission, they have to watch that video. So I'm expecting that you're familiar with the format of OET writing. Format means where do you write the reader's address? Where do you write the date? Where do you write the RE part? Now I'm just going to talk to you about the first paragraph placement, how to do and what to do with the first paragraph. So uh, it's on that video as well, but I'm going to simplify this for you guys again because you're going to do this as a homework. So I request you not to note down a lot of things because if you copy whatever I'm writing at the moment, I'm sure that you're going to copy the same thing for the homework tomorrow. Yeah. So just understand and make mistakes. The more mistakes you make, the better it gets. Right. So it's very simple. See, I am writing. This is a very popular format uh, among OET aspirants. Here, I'm writing to, of course, refer. Refer, what's her name? Mrs. Price. Sorry, I'm very bad at typing. Price. What's her age? And 86 year. It's going to be hyphenated. Year old female. If the marital status is given, then we can also, the husband already deceased, right? You can also make it a widow. Widow who, and then I'm going to put A for B. I'm going to explain you what is the meaning of these dots. Yeah. So, of course, if you were to write a discharge letter, okay, there's a mistake there, spelling. Sorry, refer. Not very good at typing. Here you go. Uh, so I am writing to refer. I'm writing to discharge. I'm writing to transfer. Of course, that refer can be changed to some other forms as well, depending on the type of letter that you're doing. But here, what I'm focusing is what do you do in that blank A and blank B? So remember, the introduction of the letter, these things you can note, the instruction that I'm giving you. The introduction of the letter should be written in maximum 2 sentences. Yeah, not complicating our lives too much. And it should always contain two important information. Number one, so A is going to be like this. A is what is going on with the patient. I simplify it like that. What is going on with the patient? Patient. Patient. Then, sorry, please excuse the capitalization. And the second one is what do you want from it? So at least in the initial phase, I want you to focus on the things that I've just typed, A and B. Of course, there are thousands of ways in which a letter can be written, but having a basic framework and a structure is important. So just memorizing this at least gets you going. You can start the letter. So seeing so much information, we just discussed so much information about Mrs. Charlotte Price, but what to put where and how to initiate is always difficult. So what is going on with the patient? What do you want from the reader? You have to memorize this when it comes to OET writing. So what is going on with the patient and what do you want from the reader? What is going on with the patient? What do you want from the reader? You just memorize this. The meaning is, so where do we find the answers or the answer of A and B? What is going on with the patient can be found in diagnosis most of the time. Most of the time. Sometimes you need to also guess it by yourself. So what is going on with the patient? Suffered a mild concussion. We managed the patient. The reason why the patient presented to us was mild concussion. So what did we do when the patient presented to us after having mild concussion? We managed the patient for mild concussion or for concussion, isn't it? I mean, if any patient presents to us, what do we do? Do we do puja to them in the hospital? Of course not. We managed, we intervened. So you can write that who was intervened for concussion or who was managed for concussion. That is the answer for A. But infected right toe also is what is going on with the patient. So you can write it somewhere else or you can put it in the introduction as well. That's an option. I would not put it in the introduction, but if you want to put it, that's fine as well. So who was managed for mild concussion and infected right toe discovered during hospital stay? That is A part. And what do you do with the B part? What do you want from the reader? What do you want from the reader? What do you want from the reader? Usually we find it either, oh goodness, sorry, wait. Either at the top here, or do you find here? She's now ready to be discharged with home visits from a see, it's already there. So what are you expecting from the reader of the letter? Home visits. Don't you see? So we either find it there or we find it at the bottom somewhere in the writing task here. You see writing task. Using the information in the case note, write a referral letter to Miss Leila Ward, community nurse, Ashton Healthcare, outlining the patient's current condition and needs for ongoing care. So this is also what we need from the reader. So I've told you the location. I would write home visit or ongoing care, any of them in the introduction of the letter. That's my choice. Or maybe I'll write home visit and ongoing care, or home visits for ongoing care, to maintain ongoing care. Either of them can be used in the introduction of the letter. Now, my personal suggestion would be in this case that if ongoing care is given at the bottom, then the letter also has a closing ending. You can use ongoing care at the ending, and you can use what is going on with the patient at the top. Sorry, not what is going on with the patient. What do you want from the reader? Here, we need a home visit. So by reading the first, the top of the letter and bottom of the letter, we've come to realize that what do you want from reader? We have two things. That's number one is home visit. Another one is ongoing care. Now, any of them can be used in the introduction, or any of them can be used in the closing of the letter as well. So I suggest if you use home visit in the intro, then in the closing, use ongoing care, or vice versa. So it's better that, whatever are your intention, I mean, the things that the reader has to do for you, to be kept at the top. Why to beat around the bush? Just make it clear so that the purpose is achieved. Purpose means the main motive of writing the letter should be clear within the first. So it's like a trailer of the movie, the introduction. So you should not be having a headache thinking what to write and what not to write. Let me tell you, it should not be a story. It should be two sentences max, 30, 35 words, like a trailer of a movie, like 2 minute, 3 minute trailers you see for any upcoming movies on YouTube. The same thing I expect from you guys. Don't put the whole thing in the introduction of the letter. Yeah. Similarly, talking about the closing should also have just one statement at the most, a request. You get me, right? So we are going to base our letter, the base of the house we're building, on A and B. Now, let's imagine, I'll give you an example. Just keep listening to what I'm saying. So this is a place we have to go. This is the road around the house, or whatever it is. You see it. I'm very bad at drawing, sketching, whatever it is. But I hope you understand what I'm trying to say. I mean, all roads, right? These are all roads. Please don't laugh at my drawing skills or whatever it is. Here. So if you want to reach this destination from here, you can also go from here. You can also drive around. Maybe there's another road, and you can go from here, and then you come here, and then go here. Or you can go from here, drive around from there, and then enter from here, and again go and enter here. Or you can drive from here. Maybe there is a road, another one. You can come here. Or if you want, you can go from here. This particular place can be entered from many ways, right? This is road A, road B, road C, road D. You get the idea. Now, why am I giving you this analogy? Is because we have already decided what to do with the first paragraph of the letter. We're going to include what is going on with the patient and what do you want from the reader. So the second paragraph has two directions. Two directions, sorry. This is one, and this is another. Let me simplify it further. Let me repeat. So the analogy that I gave you a while ago, example one, that particular house had many ways to reach, but our second paragraph has only two ways to reach. The way number one is what is going on with the patient. Way number two is what do you want from the reader. So now you should question yourself, what is going on with the patient? Okay, mild concussion. Now ask yourself more questions. How do I know that the patient has mild concussion? Yeah. So what are you going to write? Who was managed for mild concussion? who was intervented for mild concussion. Remember, I just told you that when the patient comes and gets admitted in the hospital, we don't pray the patient. We are going to manage the patient, right? So, because of our successful management, because of the way we have managed the patient is at the verge of getting discharged. The patient is ready to discharge, isn't it? We did something good, isn't it? That's the reason why the patient's feeling better. So, in the introduction, you're going to write who was managed for mild concussion. So, okay, what is going on with the patient? Managed for mild concussion. So, what do you do in the second paragraph for my managed for mild concussion? Ask yourself a question. What is going on with the patient? Managed for mild concussion. How do you know that the patient was managed for mild concussion? So the question that I want to ask you here is, does the social background prove that we managed for concussion? Check it out. Just read this. Very easy. All the proofs are on the screen. So let us think, which is going to be our second paragraph? Is it going to be social work background? Is it going to be medical history? Is it going to be medical background? Is it going to be medication? Is it going to be nursing management progress? Is it going to be a discharge plan? Well, let me tell you one. Spoiler alert. The discharge plan is always written just one paragraph before the ending of the letter. So the discharge plan doesn't even come into the equation. We're not going to talk about it. So out of nursing management and progress, out of medication, then we have medical background, we have medical history, social background, diagnosis, discharge, admission date. Which one are you going to put as a second paragraph? So what is going on with the patient? Managed for mild concussion. So does social background prove that the patient is managed for mild concussion? See, the second paragraph says, look at this carefully. Lives alone, retired, two children, both medical doctors. Does it prove? So let's imagine you put social background as a second paragraph. Does it prove that the patient was managed for mild concussion? Husband deceased 14 years ago, 14 years ago. Owns a dog, neighbor walks the dog, lives in this. Does it prove? Of course not. So we are not choosing. If we take road number one, that this is the road number one. If we choose that, it doesn't prove anything. So this is a wrong direction. If you take road number one, yeah. Now let's take other kinds of roads. Let's think about the medical history. Now we said managed for mild concussion. Does severely infected right toe, conjunctivitis, skin cancer small, knee replacement, whiplash injury? Do they prove mild? Do they prove management for mild concussion or just concussion? Again, no. Medical background: hypertension, 25 years, occasional drinker, whiskey, heavy smoker, cigarettes, urinary incontinence, mild scoliosis, walks with stick. Does it prove management of mild concussion or concussion? Does the medication prove the patient was managed? No. And look at the nursing management and progress. This one proves the management of mild concussion. Why? The patient is deemed fit for discharge. The patient is in a situation, in a position where she is fit for discharge. So, what is the basis of discharge? This one, see? Satisfactory, satisfactory. Basically, out of all these headings that have been given to you, nursing management and progress is the best option if you take road number one. Road number one is what is going on with the patient. Now, road number two, this was the road number two, remember? What is going on with the reader? What do you want from the reader? From a reader, let's imagine you want a home visit. Now, why do you want a home visit? You ask a question. Goodness, sorry. Why do you want a home visit? If you ask yourself, does discharge plan prove? Why do we want a home visit? No. Does nursing management and progress prove that we want a home visit? Of course not. Medication, does it prove? No. Medical background, does it prove? No. Medical history, does it prove why we need a home visit? No. Maybe a little bit. She is pretty dirty, has had conjunctivitis, gastroenteritis. Yes, that means she's not able to take care by herself. But the social background proves why do we need a home visit. First of all, she's 86 years old. That's pretty old, isn't it? Lives alone, doesn't want any visitors, retired. Maybe we can mention two children at the most. We don't husband deceased, but we do not need to mention about lung cancer. Owns a dog. We don't care. I mean, the reader knowing that the patient has a dog, how does it change anything? Of course not, right? So we're giving the home visit to do the daily dressing of the wound and checking if the patient is taking medication on time or not. Just having a dog, what does it change? Tell me. The reader having a dog. Okay, the reader has a dog. So what? I'm not even going to include that into the letter. I mean, you can include it, but it's going to be a mistake. You should think like that. Lives in a three-bedroom house. Okay. Wants to live independently. Okay. Refuses meal delivery service. Okay. Reluctant to see the doctor. Yes. Okay. At risk of fall. From the reader's perspective, all these are important. So social background or the nursing management and progress can be the second paragraph, depending on the road you take. So there are two roads, road number A, road number B. If you take road number A, nursing management and progress, road number B is going to be uh, social background. There is also one more road that's called road number C. But that road number C is going by a helicopter, not even taking a road, just taking a helicopter. That's the best option. And that's going to be the quickest option as well. But it needs challenge. I mean, it's difficult to fly a helicopter, isn't it, compared to a car? Why am I telling about the third road? So, third road is going to be slight mixture of social background, slight mixture of medical background, and a slight mixture of nursing management progress. So, remember, I just told you a while ago, you're beginning how to walk at the moment. So, just think about these two roads at the moment. The third road is going to be a merger on your own acumen. So, as per my understanding, what am I going to write? I'm going to say that she lives alone, she has nobody to take care. On top of that, she has questionable hygiene that has resulted in conjunctivitis and gastroenteritis in the past. She has severely infected nose, sorry, not nose, sorry, toe because of that issue. And I am also going to include that during 2 days of hospitalization, the patient's condition was found satisfactory and therefore the discharge. So the merger, so the irrespective of the way they have put the headings, you choose only the important things that are needed and put it as a second paragraph. That is going to be the road number C, and usually that road leads to a B band or a higher B band because when you gather information from different sections and merge it into one sentence and put it in as a second paragraph, when you put it rationally, you use your own language structure, you use your own sentence structure, you use your own head, and obviously that is going to be awarded. So that's the difference between a C plus and a B band. Of course, grammatical errors also contribute to that, but I'm just giving you a general idea about these three roads. So once you have written the first paragraph and second paragraph very well, that means your letter is well begun. You've begun the letter very well. Yeah. I hope I've made you understand. So for now, we just talked about the relationship of the first paragraph with the second paragraph, and we've not talked about anything else. After that, just go in any direction. So imagine if you want to put social background as the second paragraph, then obviously nursing management and progress is going to be the third paragraph because that is also important, equally important as social background. It just depends which road you're taking. Yeah, agree, disagree. Agree. Then we have medical history and medical background. We can merge it into one if you want. And let me tell you that 1987's injury doesn't play any role. Knee replacement in 1998, that was a while ago. See, we are in 2018 at the moment. We are in 2018 at the moment. And then why do we need to talk about things that happened in 1998? Because it doesn't have anything to do at the moment. She also had like skin cancerous mole removed in 2000. She had knee injury. She has whiplash injury. We're going to throw this out. It's useless because it is not playing any role in the current condition of the patient. But we are definitely going to talk about the conjunctivitis 3 bouts, gastroenteritis. We're going to definitely talk about that. We're also going to talk about the severely infected right toe. Then, so what I'm saying is that medical history and medical background can be merged into one without a doubt. Because if you remove these three from here, then we have only one sentence, isn't it? And one paragraph containing only one sentence doesn't look very good. So why not merge this with this one? You can even put a medication. So hypertension is already given. Ramipril works for that. For mild scoliosis, she is on ibuprofen. See, it's written here at the bottom, you see? Isn't it? See? Ibuprofen for scoliosis on a need basis, Ramipril for hypertension, amoxicillin you can put somewhere else. So basically, medication, medical background, and medical history can be merged into one paragraph instead of writing three separate paragraphs because I've proved that to you. In medical history, the last 3 points are useless because it doesn't do anything to the current standing of the patient. Right? Patient is a smoker. Yeah, of course, smoking and drinking you can mention. Of course, there's no doubt about that. But other parts here, so you see, scoliosis you're going to write anyways for medical background. So why not to add ibuprofen to that? If you're writing hypertension, then she's on Ramipril for hypertension for 20 years, 25 years. You can merge all of them and make one sentence, one paragraph, isn't it? So basically, so introduction, I've already told you what is introduction. Then the second paragraph is going to be either a social background if you go road number A, or it's going to be a nursing management progress road number B, or if you want to go by helicopter, that's going to be a road number C. And then the discharge plan has its own paragraph, and after that we have medical history, medical background, and medication merged as one paragraph. That is going to be another paragraph. So let's see how you do it. So I've given you the hint. Now, we talked about the opening of the letter. Let us talk about the closing of the letter as well. Now, there are many ways in which it can be written. Of course, the popular ones that I'll write here, it's very common in OET. So, in light of the above, in light of the above. So, in the introduction, if you wrote home visit, then in the closing, let's write what? We can use ongoing care. See, needs for ongoing care. We can use that here in the closing. So in light of the above, or there's another, we have other as well. Considering the above, kindly follow up. What was it? Follow up care? No, I forgot. Wait 1 second. Kindly provide ongoing care. So let's write like this. In light of the above, in light of the above, in light of the above, kindly provide, yeah, ongoing care to Mrs. What was her name? Price. Done. Game over. After that, you write if you have any queries. That's a sign. I mean, you write it. You don't. You write. You don't write. Doesn't matter that much. You know the format, of course. So what I was discussing is that how do we choose? How do we initiate a letter? And I've given you all the possible hints for you, and I want you to form into a letter so that you make many mistakes and we begin our editing. We You write, I edit. You write, then I edit, and that's how it's going to work. Yeah. So, do you have any questions? Any questions? Have you understood everything, guys?